Hello, and welcome to the first episode of D Talk, the new podcast series of the International Diabetes Federation. I'm your host, Phyllisa Deroze. We kick off the series with a conversation on the mental and psychological impact of living with a chronic condition like diabetes. I'm delighted to welcome our guest today, Ken Tait. How are you doing?
I'm doing fine. Nice to meet you again, Phyllisa. How are you?
I am good. Ken is from the UK and is a psychotherapist, mentor, and management consultant. He lives with type 2 diabetes. Ken is a member of the IDF Blue Circle Voices Network. Ken, thanks so much for joining us.
You're welcome. I'm glad to be here. Thank you very much for inviting me.
So, my first question for you, Ken, is diabetes distress. It's a term that's used to describe when a person feels frustrated, defeated, or overwhelmed by diabetes. Can you tell us more about it and how it differs from other mental health conditions?
I suppose there's there are similarities, but there are great differences, as you so rightly pointed out. I think one of the differences is probably does diabetes causes uh, the emotional problems. I tend to call them emotional problems rather than mental, because that seems a rather medical terminology to me than anything else.
Yeah.
Uh, and yes, we, our causes, as I said, diabetes can cause these problems because it is what do you call it, a disease that affects our nervous system. That's our main problem, and that affects the brain and everything else. And I think our uh, main problems are probably with the hypos or hypoglycemia and hyperglycemias, where uh, your brain doesn't work right. So if I can put it that way, where you, if you're in a hypo, you tend to go into different moods, and people can be very annoying to you, even though they're not annoying to you, and all that sort of thing. And you get anxious and anxiety and everything else going with it. I think, as you probably well know, it does really affect you in that way. I think the other area is probably burnout,
Mm.
where you just get so fed up testing yourself, injecting yourself, or whatever. Even people that are not on insulin, they just get fed up with it and just say, "Oh, I don't have a diabetes. I'm just going to
Right.
give up and everything." So these are probably our areas, but they all lead to the same thing,
Okay.
which is depression, anxiety, stress, and stress can lead to the other two areas. And obviously, unfortunately, diabetes can cause depression and anxiety. And guess what? When we have diabetes, we get depression and anxiety.
Yeah.
So it's a double-edged sword, as the saying goes. I think the other area that we need to cover, in a sense, is stigma.
Okay.
Though, yeah, because the, if you're getting stigma from various sources, and it could be a healthcare professional, it could be the media, it could be your family, it could be your friends, it could be just anybody walking along the street, just about. And it can really play on you to not function properly, if you see what I mean. And we need people to understand that stigma, diabetes is a hidden disease, as you know. Nobody can see it unless you're doing finger pricking and, as I call it, stabbing yourself in public. But it is an area that we really need to combat, and I think in a big way. And it's not often known that people, obviously, as well with between the different types. It's
Right.
we have the what heard the other week there, and I thought it was absolutely brilliant, was othering, where it's not mine, it's the other person.
Right, right.
You know, and when you get that sort of thing, the person that thinks it's diabetes is about sugar and things, guess what? They still think about it as being sugar because it's still diabetes as far as they're concerned.
Mhm. And can you just give an example of stigma, Ken? I know that, when you're in the diabetes space, we understand it, but like for people who don't know what diabetes stigma is, what would be an example of it?
Basically, we get these questions, should you be eating that? That I think is probably the biggest one that we tend to get, and as I said, if you're a type 1 diabetes, you can eat that and nobody worries about it and everything else because you give insulin. But if you're a type 2 diabetes, in a sense, you're not supposed to have that
Mm,
cake.
right.
I kind of disagree with that. what I what I think is, yeah, it's fine to have the cake now and again in moderation and everything in moderation rather than eating the whole cake. I wouldn't eat the whole cake anyway, but you know what I mean.
Yeah, sure.
And people also, if you're obese and everything else, then they think automatically that you are a type 2 diabetes or a person with type 2 diabetes. And it's the same for people like yourself, people of color, where they really have that stigma,
Yeah,
where they really, you know, oh, because you're a person, you have type 2. You may have type 1. You
yeah,
may have LADA. Who knows? Until you get tested. But because they see that, that is what they assume. And that's been portrayed, unfortunately, in the media and also by healthcare professionals, I must admit, in a big way.
Now,
Yeah.
continuing with healthcare professionals, like you were diagnosed with diabetes, I was diagnosed with diabetes. It was extremely emotional for me. But like for you, how was it? And do you feel that healthcare providers are doing enough to address like the emotional side of the diagnosis?
I was diagnosed 22 years ago, or as I call it, I was married to my diabetes 22 years ago. Unfortunately, it's till death us do part. um, the I took it in my stride in a sense, I suppose, maybe because of my own training and everything else that was going with it. But you're right, emotional side is never, unfortunately, or hasn't been until probably just recently, been part of the looking at you as a whole person rather than somebody who just has diabetes thing. And I think that needs to be much more looked at, especially, as I say, the emotional side, because we talk about our figures, our HbA1c, our 3 monthly checkup and everything else. And these can be emotional problems as well because they can go high, as you well know. They can go lower. And that could be for various reasons. And it can be for things like stress, depression, anxiety. So by having that knowledge and ask the healthcare profession, asking the question, what is or what has happened in the last 9 months of since we last met or whenever it was, because that could be the reason. You know, as you know, diabetes doesn't play fair. It decides what it wants to do, and you have to go along with it.
Very true.
Yeah. So I think that is probably much more to my way of thinking, that we need healthcare professionals to ask the questions. Because if they don't ask the questions, then they're not going to know the whole story.
Very true.
And the unfortunate thing is, we as people with diabetes and patients generally always lie. We always lie.
We lie. And tell me more.
Yeah, did you have that piece of chocolate the other day there? No, I didn't have any
Oh,
chocolate.
Did you check your blood sugar fasting? Of
Yeah.
course I did.
Yes, I took it for a hypo, but you didn't have a hypo. Okay, but
Right, right. I get it. And since you're in the UK and I'm in America, can you tell me what it's like for mental health or emotional support in the UK?
I don't know about America very much, but it's probably not great in the UK, and I totally believe that. Unfortunately, because we have different ways of working in the healthcare. You have insurance, or we have what's called the NHS, National Health Service, and everything is free. But and people want to have free health, emotional problems or counseling or psychotherapy, and that can be a very, very long waiting list. And I think there's not enough people like you and me, Phyllisa, who have got diabetes that can actually help these people. Because a lot of psychotherapists and counselors, and I'm saying psychotherapists and counselors rather than psychologists, because they are a totally different breed entirely, um, don't have diabetes and don't understand it.
Okay.
And I think that needs to be some sort of training needs to be done on that way. And I'm just blowing my own trumpet because I'm a private psychotherapist. But there we go. But no, it is true. It is a very long waiting list in the UK, and they need to bring that down in a bigger way.
I would say it's similar in the States. Like, I only recently heard about a psychologist, psychotherapist, psycho anybody that focuses on diabetes. And I was just like, wow, like what an appointment that would be for me. Like, I've been in therapy for various reasons, but never for diabetes. And I think that would be important. Um, so,
Yeah.
the next question I have for you is what practical tips would you give people living with diabetes to help them cope with with the psychological impact of their condition?
Unfortunately, you have to listen to your healthcare professional. That is that's paramount. However, you need to make sure it's a good healthcare professional, and I will say that in a way. Somebody that understands diabetes, not just giving you a pill and telling you to go away and do some exercises and you'll be fine. Diabetes, it's a progressive disease for type 2. Type 1, unfortunately, they have it for life at this moment in time until it is a cure. Uh, and that can be a long way off. They keep saying it's every 5 years, but it doesn't happen that way, unfortunately. So my main thing is I would always say you manage your diabetes, not the diabetes managing you.
Oh, nice. Yes. Say
Yeah.
that again.
You manage your diabetes, not your diabetes managing you. And I mean that, but you know, we get so involved in our figures, the HbA1c, our daily pricking of our fingers, or if you're lucky to have one of these CGM things, then fine. And you look at it and you think, oh, it's going up. And you get so worked up about it. It's just to say, okay, what's happening? And just look at it over a long period of time. And as I say, if you can get a good healthcare professional, then that is fine. They can help you to understand that a bit better because that's the technical side. We don't know the technical side. We are experts in diabetes for us, but we don't know really the technical side, unless, of course, you're a doctor or somebody that has actually studied it. But we have to find out for ourselves, find out information as well. I see a lot of people going onto the internet, especially for people with type 2 diabetes, and they look at all these diets.
Yeah.
they're going on. Yeah. And they think, oh, yeah, I'll try that one. Oh, that didn't work. I'll try this one. Oh, that didn't work. And guess what? Before not long, you actually become having an eating disorder. And that is something that I kind of worry about, especially in the NHS and the way that's happening in the UK, is everything is now pre-diabetes, is trying to walk what they call walking away from diabetes. Looking at your food intake and everything else, and going on some sort of diet. Even they have a one called an 800 diet for those that have diabetes. And you think, well, after a while, because I have seen so many people coming into my, to see me, they will have eating disorders because you lose weight. You think this is great. I'm fine. I'm okay. I'll start eating again. And guess what happens? You put it back on again, and sometimes more. So you go back on the diet, and you keep doing this cycle, and your body doesn't like that too much. And diabetes loves it, by the way.
I think that's such an important thing to bring up. While, I don't think I had an eating disorder. I don't know, but I remember being diagnosed and thinking what I can eat, can't eat. Like I was hyper focused on everything that went into my mouth. And yeah, it does cause emotional feelings.
Yeah, I mean, for the first 2 years, I didn't eat chocolate because I was, oh, I can't eat anything sugar. I can't do this. Can't do that, and the next thing. And then I had an endocrinologist in Edinburgh, not where I am now, and he turned around and said, "No, life is for living." You know, so enjoy that chocolate, enjoy that cake, enjoy the sugar rush. But as I said before, not all the time.
Right, right, moderation. Right.
Moderation, and manage your diabetes. Yeah. And I think the thing that also is first diagnosed. Sometimes healthcare professionals will say, "Yeah, you'll eventually go on to insulin,"
Right.
and they can actually use that as a weapon. If you don't behave yourself, you will you'll be going on insulin. Insulin should never be fearful or weaponized in any shape or form.
I agree.
You
I
know,
agree 100%. Yes.
it because if you were a normal person, guess what? You make insulin.
Yes. Excellent. As we begin to wrap up our time, I have enjoyed this conversation so much. I don't want you to go without one last word. Is there anything that, is burning for you to say about mental health and diabetes?
If you're feeling bad, if you're feeling low and you're not wondering what's happening, either talk to somebody that will just listen, because listening is the paramount. Not to listen to reply, but just to listen, or find good professional help.
Okay.
Because it can lead to various problems like suicide, unfortunately, and especially the younger generation. They, especially type ones, will stop taking their insulin because they want to be normal like their friends.
Right.
You know, you are normal. You just have something extra, unfortunately, and just go with the flow. And as I said, manage your diabetes. Don't let it manage you.
I like that. Thank you so much, Kim, for this very stimulating conversation. We've heard a lot of useful insights that I'm sure will be of value to our listeners across the world. Before we close, I'd like to ask you to share where our listeners can find you on social media if they have any follow up questions.
Uh, they can find me on Twitter,
Okay.
and I'm actually called Bromley Diabetic.
Can you
Or
spell that? Brumley diabetic? Just spell
Bromley, diabetic, obviously, DIABI, whatever. Or they can find me on Kifty, which is KIFFTY. And for the phonetics, it's Kilo India Foxtrot, Foxtrot, Tango, Yankee.
Okay. Thanks so much again, Ken. That's all for this month. Thanks for listening. And make sure you join us next month for a brand new episode of D Talk Conversations in Diabetes, brought to you by the International Diabetes Federation.